Welcome to this introduction to the Regents Hospital Blunt Trauma Imaging Protocol. The purpose of this protocol is to teach one good way to order imaging studies. This is not necessarily the only way, but it is based on the literature as much as we've been able to accomplish that. It's also meant to help standardize ordering practices so that all clinicians will order things the same way based upon the same patient presentation. A few positive side effects should be that we will be able to reduce any unnecessary radiation exposure. We'll be able to conserve resources so that patients aren't moving back and forth to CT scan on multiple occasions and blocking access by some other patients. And then finally, it will help speed patient flow through the emergency department since patients will not have to continuously go back and forth if studies have been accidentally omitted. The imaging protocol will officially be implemented on November 1st. Worksheets have already been distributed to areas where orders will be written so that people can begin looking at them and practicing before we hit the November 1st startup date. It only applies to a specific group of trauma patients. First of all, it only applies to adults, and our definition of an adult is age 16 or greater. They must be a blunt trauma patient. We have not implemented a protocol for penetrating trauma as of yet. And these patients must be admitted to the hospital. Now, sometimes it's not easy to predict who might be admitted, so in those cases it's best to just err on the side of engaging in the protocol. And finally, this does not just apply to trauma activations. This applies to any trauma patient, trauma consult, who comes in through the door and is likely to be admitted. Worksheets are being made available in all work areas. They will be placed in each trauma team activation packet. They'll be available in the form slots in both of the trauma resuscitation rooms. They'll also be available in any of the ED pods where it is likely that trauma patients might be seen. One thing to remember, though, is that this is not an order form. This is a worksheet. It is designed to help you figure out what the indications are and which ones have been met in order to place orders for a particular study. This is a close-up of the top half of the front page of the form, and this just shows you the indications for each specific study. So for example, if you have a patient who comes in who is suspected of having a head injury, they fell down a flight of stairs, and they happen to be an age of 70, then these two boxes would end up being marked. And that means that this patient would require a head CT. The same thing can be repeated for each of the areas. At the bottom of the front page of the form is a very important spot, and that is the notes block. We recognize that it's not possible to predict the need for scans or other imaging in every specific patient. Various presentations may arise where things are not covered by this form, and we encourage each physician to use their own judgment and determine which studies are appropriate or not appropriate. However, if you do order a test that is not indicated by one of the checks on the form, or conversely, there is an area that is checked and you don't feel that the study is warranted, do what you think is right, but be sure to add a notation in this notes block explaining why you did or did not order a particular study. These forms will be analyzed by the trauma program, and any variations that are found will be referred back to the ordering provider so that we can try to figure out how we might improve this process. So be sure to describe any variances in that comment area. When you have finished filling out the form, transcribe the imaging orders to either the trauma team activation order sheet or enter it into Epic, depending on whether or not this patient is a TTA or not. Make sure that a sticker is present in the upper right-hand corner of the front page so that we can identify who the sheet belongs to, and then keep the form with the patient's paper chart. We will retrieve it from that area when the patient is admitted. We will provide regular updates on this entire process on a fairly regular basis at our trauma conferences. And again, I'd like to thank you for helping us with this project. We hope that it succeeds in improving the way that we order our tests and also provides the best care for our patients.